Okay, specialties and the cons of the specialties, which I could talk about this all day, but I'll try to stick to the basics for you. Okay, so starting with general, general is cool because general encompasses a lot of different procedures. There are several procedures that lie under the general umbrella. However, I would say one of the cons is that like 90% of them are in the belly, which means you're going to have a million instruments to count, and it's just annoying having to count instruments for every single case. Another common specialty is ortho. Ortho, personally, is one of my favorite specialties. However, you're basically going to be wearing lead in every single case, and I don't care how cold it is in your room, you will be sweating profusely under the lead, and it gets heavy after wearing it for several hours. But I do love all the different positions that come with ortho. Now, for CVOR, some of the cons with CV is your cases are pretty much always going to be long. Depending on your surgeon, an open heart might be 4 hours or it might be 10 or 12 hours. I have done both. And it gets kind of boring after a little while. And similar to general, there are so many freaking instruments you have to count. And the needles that we're counting, I mean, when you're, talking about 80 prolines. They're teeny tiny little bitty needles, and you cannot lose them because they won't show up on an x-ray. And it's like, that's the part about doing hearts that I absolutely hate. It's counting 180 tiny ass little needles along with the 200 instruments that you have to count, on top of it being like a 10-hour case. And don't get me wrong, I like doing hearts. I'm actually on the heart team, but it does get old, sometimes. Come back for part two.